Antifungal agents are a class of medications used to treat mycoses, or fungal infections. Mycoses can be superficial, meaning they're localized on the skin, or develop into systemic infections in immunodeficient patients. Antifungals work either through fungistatic action, meaning that they inhibit fungal growth, or through fungicidal action, meaning that they kill the fungi. Now, antifungals include the azole family and a novel class of medications, echinocandins. But there are also many other antifungals with similar or different mechanisms that we'll talk about in this video. Alright, most fungal cells have a tough outer cell wall and an inner cell membrane. The cell membrane is mostly made of phospholipids with some sterol or modified steroid molecules mixed in. Humans have cholesterol, while fungi have ergosterol. Both sterol molecules help keep the cell membrane stable at a wide range of temperatures. Now, the precursor to both molecules is lanosterol. The precursor of lanosterol is squalene. The conversion of squalene to lanosterol is catalyzed by an enzyme called squalene epoxidase. Fungi have a cytochrome P450 enzyme called 14-alpha demethylase in their mitochondria and endoplasmic reticulums, which converts lanosterol to ergosterol. Without ergosterol, the structure of the cell membrane will be disrupted. This will cause membrane-bound proteins, like ion channels, to stop working properly. The membrane also becomes fragile, which eventually leads to inhibition of fungal growth. Alright, let's start with polyenes, which are naturally derived antifungal antibiotics that alter cell membrane permeability. They include amphotericin, also called amphotericin B, and nystatin. Polyenes have both hydrophilic characteristics, meaning that they love water, and lipophilic characteristics, meaning that they love fats. They bind to ergosterol, and the hydrophilic core causes the formation of artificial pores in the cell membrane, thereby creating a leaky membrane. This causes significant changes in ion balance, including the loss of intracellular potassium. Depending on their concentration, polyenes are either fungistatic or fungicidal. Now, amphotericin B is one of the most important medications for the treatment of systemic mycoses. It's used to fight systemic infections caused by Aspergillus, Blastomyces, Candida albicans, Cryptococcus, Histoplasma, and Mucor, either alone or in combination with other drugs. However, nowadays several azoles and echinocandins are proving to be just as effective in specific systemic mycoses as amphotericin B is, with less risk of toxicity. Amphotericin B is also used in the treatment of visceral leishmaniasis, caused by protozoan parasites of the genus Leishmania, that presents with fever, weight loss, fatigue, anemia, and substantial swelling of the liver and spleen. It's usually given by slow intravenous infusion, as it's poorly absorbed by the gastrointestinal tract. In fungal meningitis, intrathecal administration, meaning injection into the spinal canal, or into the subarachnoid space, has been used, since the drug is widely distributed to all tissues except the central nervous system, or CNS, when administered intravenously. It can also be administered locally in the treatment of mycotic corneal ulcers and keratitis. Amphotericin is mainly eliminated via hepatic metabolism, while a small fraction is excreted through the kidneys. Alright, now common side effects are infusion related and include fever, chills, muscle spasms, vomiting, headache, and in more severely affected individuals, hypotension and anaphylactoid reactions. The most serious side effect is renal toxicity, which is dose dependent and can be decreased with hydration. Anemia might also happen due to a reduction of erythropoietin production from the kidneys. Amphotericin decreases glomerular filtration rate in the majority of patients, which improves after treatment stops, and causes renal tubular acidosis with loss of magnesium and potassium. This can lead to hypokalemia and hypomagnesemia, which often requires subsequent potassium and magnesium supplementation. The electrolyte imbalance can cause arrhythmias. Other side effects include impaired hepatic function, and intrathecal administration might cause seizures and neurotoxicity. Next, nystatin is an antifungal agent that's only effective in the treatment of candida infections of the skin, mucous membranes, and gastrointestinal tract. It's used either topically for superficial infections or orally to fight gastrointestinal fungi in patients with impaired defense mechanisms. Side effects for the oral form include gastrointestinal disturbances like nausea, abdominal pain, vomiting, and diarrhea. Both the oral and the topical form can cause hypersensitivity reactions like Stevens-Johnson syndrome, which is a dangerous immune-mediated condition that affects the skin and mucous membranes, like the mouth and genitals, and also rashes, itching, and burning. Moving on to terbinafine, which is a synthetic antifungal antibiotic that alters cell membrane permeability. It acts by inhibiting squalene epoxidase, which is involved in the synthesis of ergosterol from squalene in the fungal cell membrane. This accumulation of squalene is toxic for the cell and is responsible for the fungicidal action of terbinafine. Now, terbinafine is both lipophilic and keratinophilic, meaning it accumulates in adipose tissue and in keratin, the key structural material of hair and nails. It's used to treat dermatophytosis of the skin, also known as ringworm, which is a fungal infection of the skin that results in red, itchy, circular rash, and is very effective against onychomycosis, a fungal infection of the nail that causes white or yellow nail discoloration, thickening of the nail, and separation of the nail from the nail bed. Terbinafine can be administered either topically or orally. Side effects are mild and occur rarely, and they include gastrointestinal disturbances, rashes, headache, dizziness, and taste disturbances. Alright, now griseofulvin is a naturally derived antifungal agent isolated from cultures of Penicillium griseofulvum, and can be used just like terbinafine to treat dermatophytosis of the skin and nails. However, it has been largely replaced by terbinafine and the azoles. Now, griseofulvin interferes with fungal microtubules, thus affecting mitosis. The oral form is the only one available, as griseofulvin is not active topically. Side effects include gastrointestinal disturbances, headache, photosensitivity, as well as allergic reactions presenting with rashes and fever. Griseofulvin should not be used in pregnant women, as it can harm an unborn baby or cause birth defects, in patients with porphyria, which refers to a group of disorders where substances called porphyrins build up in the body, in patients receiving warfarin, an anticoagulant, as it decreases its bioavailability, resulting in decreased anticoagulant effect, and with ethanol, as it causes disulfiram-like reactions. So when the person drinks alcohol while taking griseofulvin, they'll experience severe nausea, vomiting, and headaches. Last but not least, flucytosine, also known as 5-fluorocytosine or 5-FC, is a synthetic antifungal agent that's converted to the antimetabolite 5-fluorouracil, or 5-FU, by the enzyme cytosine deaminase in fungal but not human cells. 5-fluorouracil fights fungal infections by blocking DNA synthesis. Now, flucytosine is effective against a narrow range of systemic fungal infections. It's used in combination with amphotericin B or triazole for severe systemic infections like candidiasis, cryptococcal meningitis, and chromoblastomycosis caused by molds, a long-term fungal infection of the skin and subcutaneous tissue. Alright, now flucytosine can be given orally, or intravenously since these patients are usually too ill to take medicine by mouth. It's distributed throughout the body, including the central nervous system, or CNS, and it's excreted intact through the kidneys, and therefore the dose must be reduced in patients with impaired renal function. Side effects include gastrointestinal disturbances, reversible myelosuppression, or depression of the bone marrow function leading to decreased platelets or thrombocytopenia, red blood cells or anemia, white blood cells or neutropenia, alopecia or hair loss, and liver dysfunction, which is pretty rare. Now let's make a simple and fun mnemonic that'll help you efficiently memorize these pharmacology facts about the miscellaneous antifungal medications. So monsters are attacking the city of New York. Oh no. First by C, we'll have the drugs that increase permeability of fungal cells. Let's start with a giant amphibious salamander for amphotericin B. It's attacking the NYC Statue of Liberty, which represents nystatin. A genie wearing a huge turban for terbinafine is coming out of the torch of the statue to defend it. Now in the city, let's have a griffin for griseofulvin that's attacking from the skies. It broke a bunch of lampposts to help you remember it targets microtubules. Finally, there's a flying cyborg for flucytosine, and he's shooting lasers at a helical building that's under construction to help you remember it inhibits DNA synthesis. Alright, now that we introduced the drugs, let's talk about their indications and side effects. Amphotericin B is a broad-spectrum systemic antifungal, so let's have a wide variety of mushrooms growing along its back. It's also effective against leishmaniasis, so let's put a leash on the salamander so it can't leave the sea. For side effects, this drug can cause severe fever and chills. So let's set its head on fire and its tail frozen in ice. It can also cause renal and liver damage, and this is represented by a half-eaten kidney and liver floating beside it. A magnet and a banana are also floating next to the monster since it causes a decrease in these electrolytes. For nystatin, let's have candy-like mushrooms growing on the Statue of Liberty's face and mouth, since it's used to treat skin, mucosal, and GI candida infections. For side effects, at the foot of the statue, there's a two-headed zombie named Steve and John for Stevens-Johnson syndrome, and it's vomiting on the statue to represent GI disturbances. For the indications of the terbinafine genie, let's put some ring-like rashes on him for ringworm, and his nails are long and yellow to represent onychomycosis. A side effect that'll help you identify this drug is that it causes taste disturbances, so let's give the genie an abnormally long tongue. Alright, let's move on to the land for the last two drugs. For the griseofulvin griffin, let's also give it the ring-like rash and long, yellow nails, since its indications are similar to that of terbinafine. But remember, griseofulvin has more restrictions, and is not used as often, so we'll represent this by having people fleeing from it. First, we have a pregnant woman because it's contraindicated during pregnancy. Next is a poor beggar with a pharaoh's headdress representing people with porphyria. And finally, a soldier for people with warfarin. There's a large empty beer bottle by their feet to represent their disulfiram reaction. The griffin has a cool pair of shades to help you remember this drug also causes photosensitivity. Now our last drug is flucytosine, the flying cyborg. Let's put a small variety of mushrooms all over him since it's used to treat a narrow range of systemic fungal infections. For side effects, one of his arms is broken, and bones are jutting out to help you remember it could cause bone marrow suppression, and his bald head is very shiny to help you remember alopecia. He's carrying a damaged liver in his hand like a football to remind you that it's hepatotoxic. Alright, as a quick recap. Polyenes are natural antifungal medications that alter cell membrane permeability by binding to ergosterol and thus causing the formation of artificial pores. They can be split into amphotericin B and nystatin. Amphotericin B is used mostly in the treatment of severe systemic mycoses, but can also cause fever, chills, and severe kidney damage. Nystatin is used both topically and orally in the treatment of superficial and GI candida infections, and can cause gastrointestinal disturbances and hypersensitivity reactions. Terbinafine is a synthetic antifungal medication that alters cell membrane permeability by inhibiting squalene epoxidase, which is involved in the synthesis of ergosterol. It's used either topically or orally in the treatment of dermatophytosis of the skin and nails, and can cause gastrointestinal and taste disturbances. Griseofulvin is also used to treat dermatophytosis of the skin and nails, but it has been largely superseded by terbinafine and the azoles. It interferes with fungal microtubules and can cause gastrointestinal disturbances, photosensitivity, allergic reactions, and also decreases the anticoagulant effect of warfarin, and causes disulfiram-like reactions with ethanol. Flucytosine is a synthetic antifungal medication that blocks nucleic acid synthesis, and is used against a limited range of severe systemic mycoses in combination with other antifungal agents. It can cause bone marrow suppression and alopecia. But wait, there's more! Here's a mind map with all of the mnemonics. Go ahead and pause the video so you can test yourself to see what you remember. And stay tuned for the answers after the credits.